This is in response to Carmel. Um, the question is, I am wondering what kind of diseases massage therapists are exposed to. I always see doctors or nurses wearing latex gloves when they don't want to touch a patient, even for a simple procedure that doesn't involve any injections. Is there any chance that you could get hepatitis A or B by touching someone? Thank you. Um, the only things I could see is like tuberculosis, TB. A lot of people just say, but that's airborne kind of thing. AIDS, but that's very, very rare, of course. And the main thing is, if you know a person has AIDS, HIV virus, you can still massage them without gloves. But if they have any open areas, of course, or if you have open areas, then you can possibly wear gloves then. But just explain to the client about that because they might feel a little bit self-conscious. But it's just something you need to visually look at the body all the time too. So try not to massage areas unless you actually see the actual skin, especially for bruises, those kind of things, just to be safe. And for hepatitis too, the main thing is with massage therapy, you just got to wash your hands right afterwards. Some people even during the massage too will wash their hands, especially if you're ever going to go from the feet to the face is a big no-no. So that's why indication of rubbing alcohol or washing hands during those times. I have heard of chiropractors getting a little paranoid about clients with hepatitis, and then they make the massage therapists wear their gloves. But technically, that's not necessary as long as you use proper hand washing and all those kind of things. Because the problem is, a lot of times you don't even know if these persons have these kind of diseases or problems. That's why you want to just use universal precautions with everybody. So wash your hands continuously all the time. Then, so that's my best word of advice. And technically, yeah, there's just make sure you wash your hands at all times. Then that's the best advice I can give anybody with any kind of diseases. But if anybody else knows anything else, please leave the comments below. And I know the pathology books for massage therapists might go a little bit more into detail about all these different kind of diseases and if you could technically get them and stuff. But again, the only one I'm really scared of is TB. And for the massage program that I work for, the massage school, we used to have the students take a TB test before they even enrolled in the program. But in the last year, we actually got rid of that totally. So in Minnesota, they say there's only like around 250 active TB cases, but other parts of the world, it's more prevalent. So my wife, she's from the Philippines, and they even have TB wards in the hospitals just because it's a lot more prevalent compared to the United States. But the average person, if they have TB, they're usually really self-conscious with those kind of things. And so again, AIDS is a big one that people hear about, and I talked about that earlier. But as long as they don't have any open areas, you don't have any open areas. But it's still hard to get it that way too and stuff. So, but again, if in doubt, you can always wear gloves. But with the gloves, make sure you use 2 or 3 pairs during the massage because your hands start sweating. Or some people will use finger cots, so it's something that just goes over one finger. Or there's liquid band-aids or liquid stitches, I think they're called. It's basically super glue, but it just seals that area. So that's different options a massage therapist can use during those process then. So again, leave your comments below, and thank you.